Hi, my name is Adrian Fine. I'm a retired doctor. 45 years ago, I left Britain to come to what was then one of the very best healthcare systems in the world, here in Canada. Alas, due to government failings, we have now become one of the worst amongst developed nations. I feel personally a moral obligation both to protest and to encourage others to protest the carnage and suffering that has been foisted upon us. Thank you.
Thank you very much, Adrian. Next we have Kirk Firestone.
I moved to Canada 15 years ago, and I immediately saw that we had a healthcare system that was not serving everyone. We need equality in our healthcare. Equality means that everyone has a family doctor and has easy access to the emergency room. Each of us pays taxes. Property taxes, income taxes, sales tax, gas tax, you name it, and there's a tax on it, and it's supposed to pay for us to have health care. Equality means that if these people that work in the building behind us have family doctors, then all of us deserve a family doctor. Equality for all.
Thank you very much, Kirk. And now our lovely Ellie.
Thank you. The reason I started volunteering with BC Healthcare Matters, and the reason I'm here today, is because I truly believe that access to healthcare is a human right. You cannot have a well-rounded, healthy, thriving society without access to healthcare, period. I am here because I believe it is my duty as a resident of this country and province to stand up and speak up when I see an injustice. And what's been happening to patients, doctors, and healthcare staff in BC is an injustice. Thank you all for being here and standing up for yourselves and the rest of the residents of this province. Together we can achieve change.
Thank you very much, Ellie. And our last share from our inspiring Charmin.
Hello, I'm Charmin, and I joined BC Healthcare Matters because I was very disappointed and extremely angry, and I'm still angry, to see in my lifetime, I'm 69, that the idea of care in healthcare has vanished because overpaid bureaucrats want to save money instead of saving lives, and that successive governments have done nothing to stop this. I know all of you here feel the same way, but what can you do? Step up, advocate, and make your voices heard loud and clear. We won't be bullied into accepting the status quo anymore. We will be doing something now that usually only happens at Remembrance Day ceremonies, but is equally the right thing to do today as we mourn the loss of healthcare. We will be remembering the lost. We remember the woman who died from heart complications in an ER waiting room after waiting over a day to be seen. We remember the woman screaming for help who lost her baby in a Penticton ER washroom because there was no one available to help her. When we heard, we all felt anguish for the families whose loved ones died in those hospital waiting rooms. But let's also take time to recognize the lives that were lost that we didn't hear about. We remember those who died because they didn't get their disease diagnosed soon enough. We remember those with chronic conditions who died because their medications ran out. We remember those who took their own lives because they could no longer go on without help. We recognize every life lost because every life is important. Primary health care is a right in this country, not a privilege. We're standing firmly united here today, remembering all those that can't be with us now. Please honor them with half a minute of silence. Thank you.
Don't worry, I'll take this one, Joe. I got it. Thank you very much, Charmin, for that reminder of how precious life is and of how this issue is truly a matter of life or death.